Hello again. We are here with the second part of the skeletal system, the appendicular skeleton. Again, this has to do with the limbs and the girdles which hold them to the axial skeleton. So, we have 126 bones found in this part of the skeleton. They are primarily for movement of the body. First, we have the pectoral or shoulder girdle made of the clavicle and scapula. Clavicle is a nice curvy long bone here, kind of S shape. The scapula, we have a few features to take a look at. So with the scapula, this is the anterior view. So this area here lies against the posterior rib cage. So right here we have the coracoid process. Superior to that we have the acromion. On the lateral side we have the glenoid cavity, which is where the head of the humerus seats, is set to form the shoulder joint. And on the posterior side we have the spine. As you can see, the spine actually forms into the acromion. So the spine is for separating two muscles here, mainly the infraspinatus, which is found inferior to the spine, and supraspinatus, which is found superior to the spine. So it is these four markings or processes on the scapula that you need to know. So next we have the humerus. This is the arm bone. Okay, so we have the head of the humerus, which articulates with the glenoid cavity of the scapula to form the shoulder joint. Next we see the neck, and here we see a greater and lesser tubercle. In between is the intertubercular sulcus, where the bicipital tendon runs. Okay, that is the proximal end. At the distal end we have two condyles, the capitulum and trochlea. They have special names. The trochlea articulates with the ulna of the forearm. The capitulum articulates with the radius of the forearm. Okay, so the trochlea is medial, the capitulum is lateral. Above these we have epicondyles. They are simply named medial and lateral epicondyles. Okay, on the posterior side of the distal end of the humerus, we see the olecranon fossa. This is where the olecranon of the ulna rotates into as we flex and extend the arm. Those are the features of the humerus. Next we have the forearm made of two bones, the radius and ulna. The radius is the lateral bone of the forearm. The ulna is the medial bone. So proximally we have the head of the radius, again articulating with the capitulum of the humerus. And then at the proximal end of the ulna, we have the coronoid process on the anterior surface and the olecranon on the posterior surface. So if you flex your arm and feel the point of your elbow, that is the olecranon of the ulna. Distally on the ulna is where we find the head of the ulna. And on the radius we have a styloid process. And we also have a styloid process on the ulna. So for these two forearm bones, I want you to know the olecranon, where the head of the radius is found, and where the styloid of the radius and ulna are found. Okay, here is a closer look at the elbow joint. Head of the radius articulates with the capitulum. The coronoid process and olecranon articulate with the trochlea of the humerus. Okay, distal to the forearm we run into the wrist, made up of 8 small bones. These are known as the carpal bones. Okay, we have 2 rows of 4 bones. The proximal row is scaphoid, lunate, triquetrum, and pisiform. These are articulating with the distal radius and ulna. The distal row of carpal bones are trapezium, trapezoid, capitate, and hamate. They articulate with the metacarpals of the hand. Okay. The 5 metacarpals make up the palm and the back of the hand. They are numbered 1 to 5, starting with the thumb. The rest are phalanges, which make up the digits or fingers. We have 14 in total. The thumb contains 2, and each of the other 4 fingers contain 3. You can see that here. Here are the carpal bones. And the metacarpals, again, numbered 1 through 5, starting with the thumb. And the rest are going to be the phalanges making up the digits. Okay, at the inferior portion of the body, we have the pelvic girdle. This is where we will see the lower limbs attaching to the axial skeleton. Pelvic girdle made up of 2 hip bones, or os coxa or coxal bones. Okay, they articulate with the sacrum at the posterior side. Each hip bone is actually made of 3 individual bones that fuse together by around age 23. So we have the ilium, ischium, and pubis, and then we will see them articulating at the pubic symphysis at the anterior of the pelvic girdle. So here we see the ilium as the superior portion of this hip bone. The anterior inferior portion will be the pubis. The posterior inferior portion will be the ischium. So as you can see, there are many features along this hip bone. We're going to look at 5 specific features. So on the ilium, we have the iliac crest. So when you're feeling your waist and you feel that large ridge about the level of your umbilicus or your belly button, this is the iliac crest. On the lateral side, we find the acetabulum. This is where the head of the femur articulates to form the hip joint. Okay. Just inferior to that, we have this large foramen known as the obturator foramen. Then at the inferior portion of the ischium, we have the ischial tuberosity, more like this whole area. So this portion of the hip bone is also known as your sit bone, if you will, because when you sit down, you are actually sitting on the ischial tuberosity. Okay, one more feature, this large notch. This is the greater sciatic notch. You can see there is a lesser sciatic notch, but I am asking you to know the greater sciatic notch. You can guess the sciatic nerve runs past this notch. On to the lower limb. The first bone is going to be the femur in the thigh area. Again, we articulate with the acetabulum, forming a ball and socket joint. One thing to note about the acetabulum, all 3 of those individual hip bones fuse at the acetabulum. Okay, so the pelvic girdle, these are just some quick notes to be made about the pelvic girdle. So we have the main hip bone, the sacrum, again at the posterior side, then the pelvic brim. This is just an area of noting for past this pelvic brim is considered the pelvic cavity. Okay, and at the anterior portion, you can see we have the pubic symphysis, this disc of fibrocartilage, much like the disc found in the vertebral column. Okay, so the pelvic girdle this is not a large point to note, but is divided into a false and true pelvis. So the false pelvis is more in the abdominal cavity area. The true pelvis is where we find the pelvic cavity. Okay, just another way to see that. Males and females' pelvises are going to differ. Males larger and heavier, females wider and shallower, mostly for pregnancy and childbirth. You can note these differences here and here. All right, so the femur. Again, we form the hip joint with the acetabulum, and at the distal end, we find articulations with the tibia and patella. Okay, at the proximal end, the head of the femur seated in the acetabulum. We also see the greater trochanter. Again, trochanter is only found on the femur. And we also have a lesser trochanter, more medial. At the posterior side, you can see these both much easier. At the distal end, we see a lateral and medial condyle. And above these, we have lateral and medial epicondyles. Okay? And then on the anterior surface of this joint with the tibia and the femur, we see the patella, or the kneecap, if you will. Okay? So this patella is just a sesamoid-shaped bone, and we are actually forming in the quadriceps tendon. Okay, at the distal end of the femur, again, we articulate with the tibia, but laterally to the tibia, we see the fibula. So the lower leg consists of two bones, much like the forearm. Okay, so at the distal end of the tibia, we see a lateral and medial condyle. On the anterior surface, we see a tibial tuberosity. So this is where the patellar ligament attaches. At the distal end of the tibia, we have a medial malleolus. So this is that large knot on the medial side of the ankle. So lateral to the tibia, we have the fibula. The distal end, we have the head. And at the proximal end, we have the head. At the distal end, we see the lateral malleolus. So on the lateral side of the ankle, that large knot, that is the lateral malleolus. Okay. From there, we run into the ankle. So much like the wrist, we have small bones forming the ankle. We have 7 tarsal bones. The talus is going to articulate with the tibia. The calcaneus will form the heel of the foot. Then we see a navicular, 3 cuneiforms, and a cuboid. From there, we have metatarsals. So 5 metatarsal bones, much like 5 metacarpal bones. Numbered 1 through 5, starting with the big toe. So the big toe is going to be the first metatarsal. From there, we have phalanges. These make up our toes. Okay. Big toe only has 2 phalanges. The rest have 3. We can see those here. So the talus, again, articulating with the tibia. The calcaneus, forming the heel. Navicular, cuboid, and the 3 cuneiforms. From there, we have 1 through 5 of the metatarsals, and then the rest will be the phalanges. Okay, so that is the lower limb. From here, just some clinical notes about the arches of the foot. Okay, that is it for the appendicular skeleton. Next will be the joints.